I have advised the government today that this is a national emergency.
In a national emergency, every citizen has a duty to do what they can.
This is not just a challenge for New South Wales, but a challenge for the nation.
And one which threatens the entire nation, which is why the New South Wales Premier wants national help to tackle it.
We need to at least have a strategy in National Cabinet that does think about the options for getting more jabs in arms in Sydney.
Pfizer jabs, to be precise.
We have a micro plan for how we will get more doses of AstraZeneca in arms. But we also have to acknowledge that that is a very young population in those communities, and we need at least more first doses of Pfizer.
I want to see them today. My sense of urgency is absolute urgency. So I think we need to be seeing vaccines in arms on Saturday, Sunday, Monday.
But the man in charge of Australia's vaccine rollout isn't sold.
Vaccination underpins the national resilience to COVID. It is not the best way to provide immediate health response to an outbreak like this.
And the other states aren't having it.
Look, the number of Pfizer vaccines that we have in Queensland is so meagre, I don't think we could redirect those.
We've received our share. We need that share to continue.
We're going to have the Victorian vaccine go to New South Wales so that they can be open while we're closed.
The Victorian Premier demanding New South Wales instead protect the nation by sealing off the outbreak with boots on ground.
Sydney is on fire with this virus, and we need a ring of steel put around Sydney. I want to be able to deal with our outbreak, have it settled, and then have thousands of contact tracers on the phone helping out Sydney. I can't do that while ever we've got cases to chase, and we've got to be on this kind of hyper alert.
New South Wales Pfizer plea shot down at National Cabinet this afternoon.
Where there is a potential to put more vaccines into New South Wales, of course we will seek to do that. But we are not going to disrupt the vaccination program around the rest of the country.
Epidemiologist Professor Nancy Baxter joins us now. Nancy, did National Cabinet make the right call in shutting down this idea?
I would say that depends on your perspective. So if you're thinking about, we right now we have a Pfizer shortage. So if you're thinking about it from a utilitarian perspective, you know, if you want to get the most benefit out of each dose of Pfizer that you could, I think it's fairly clear that Sydney would be where you'd want to direct these. But when you're thinking politically from the leaders of various states, obviously they want their own people protected, and that's their priority, and that's entirely understandable. So one could understand why they would say no to New South Wales because they have their own people to protect. It's one of these situations where there's no good solution.
Well, one of those leaders is WA Premier Mark McGowan, who said today New South Wales restrictions are, as he put it, half-baked. Was it a bit rich of New South Wales to ask other states to give up their vaccines when it hasn't yet tried things like a 5K radius, curfews, or even, as Dan Andrews suggests, a ring of steel?
I don't think any of those things are really going to make a huge difference within Sydney itself. And when you think about the LGAs that have the highest rate of cases, they are very locked down right now. And those people are exposed to much higher likelihood of getting COVID than anyone else in Australia right now. And many of them are essential workers. So they're having to go out to work, and they're bringing COVID back in the community, and they're spreading it out elsewhere. So, you know, I think we can treat Sydney like a bad child, or we can kind of say that Sydney's in trouble right now. If we're in trouble in 2 months, I would hope that the rest of Australia would help us.
Professor, what about this idea of delaying second doses of Pfizer so that more people can get first doses? Do you agree with that?
Well, it's a common strategy that's been used by a lot of countries when they were facing a shortage of Pfizer. And that is that, you know, the more people you can get a single dose into, you'll at least get some benefits. And that was an excellent strategy with, you know, the Alpha variant and COVID 1.0, because one dose of vaccine had an excellent effect. It's still effective, one dose of Pfizer with the Delta variant, but less so. Having said that, you know, I think getting something into people makes sense. I'm from Canada, and in Canada, they had a real shortage. And what they did was extended the time between doses to 120 days, so 4 months actually, so they could get as many people in the country vaccinated as possible. And that was actually very effective.
The AMA is asking ATAGI to consider recommending AstraZeneca for young people in Sydney. Have a listen.
For Sydney-siders, it could be a choice between having AZ now and having no vaccine, and therefore having COVID. And we know that COVID is so much more dangerous than any vaccine.
Would you support that?
Well, you know, I think that the ATAGI advice did not say that people under age 60 could not have the AstraZeneca vaccine. It's all about risks and benefits. So I think that younger people under 40, I think having a discussion with your GP does make sense, and they're allowed to get it if they have that discussion. I mean, right now we're really not vaccinating people under 40 at all. And we really, I think, need to focus particularly on essential workers in that age group, because they are the people that are more likely to get COVID, spread it within their families and communities, and more likely to spread it to other people who they work with. They're the people that keep the engine of Sydney running. They work in the grocery stores, they work in the restaurants that take out food. They're the people that really are very essential. And I think if we're requiring people to go out to work in the middle of a pandemic, they deserve to be vaccinated. And these young people likely deserve to have access to Pfizer.
Professor Nancy Baxter, as always, appreciate your time this evening.
Thank you.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.